Thank you all for joining us tonight. For the last month or so, we've had a number of sessions focused on our preparations for returning to in-person instruction. Nearly 5,000 community members have attended these sessions as we focused on our actions and plans. Tonight, we will be focusing on health, medicine, science, and safety. Since the start of this pandemic, we've said that we've had to be grounded in science and guidance from our public health partners. Our understanding, of course, around COVID has come a long way over the past year. There are new headlines and studies and blog posts every day. And of course, it is hard to keep up with all that information. That's why we're thrilled to be partners with the UCSF Pediatric Advisory Task Force for this presentation. The goal of tonight's presentation is to help provide our community with the best, most accessible, and most up-to-date information on vaccines and COVID safety in schools. Please know there will be questions we cannot answer tonight, such as when will we be opening schools to in-person learning or anything having to do with the unions or negotiations. And please remember that the focus tonight is the medical and scientific perspectives on COVID and the vaccine, so please try to keep your questions focused there. Know that we will be monitoring the Q&A, so please put your questions in that area rather than in chat. Chat's not going to be accessible tonight. Now I'd like to turn it over to our colleague, Leilon Hewen from our Office of Equity. Leilon.
Good evening, everyone. Thanks for joining us here. It's good to be in community with you all. As you all know, our communities, all of our communities have been really impacted by the COVID-19 pandemic, especially our elders. And so, tonight I think is really just about making sure that we are all doing our part to take care of each other and working together as a team here in Oakland Unified to make sure that we can return safe.
Can I stop you there for a second, Leilon? Apparently Chinese translation is not working at the moment. I'm listening to it, not hearing anything. I can hear you now. Yes, sir. Okay, great.
Working.
Thank you.
Thank you.
And sorry, just to introduce myself for those who don't know me, Leilon Hewen with the Office of Equity, and I am the Program Manager and Targeted Specialist for our Asian Pacific Islander students, and we also serve our Middle Eastern students as well.
Sorry, catch you off again. We're having the crossover of the translation again, so I can hear you and the echo of in Chinese, which is pretty amazing. So, Mark, can we? Is that possible to adjust that? Please stand by.
Sorry, John, you're hearing? I'm not hearing.
Well, I was hearing Leilon and David.
I think it might be working for everyone else.
I can only hear their one.
Okay, all right, then maybe it's just me. Okay.
Keep going.
Thanks.
So you all know that our communities have been facing double pandemics, COVID-19, and also many of our communities are experiencing anti-Asian racism, which I know we'll be talking about today, and definitely wanting your input and feedback on how we move together as a district on that. And our Pacific Islander communities, as you all hopefully know, have experienced disproportionate rates and deaths of COVID-19, as well as our Middle Eastern communities, both communities which have been really struggling academically and to get connected digitally and to successfully log into distance learning. So we are here as partners and also with the Southeast Asian community to help families and students make sure that everybody's getting connected, make sure that students continue to be engaged as we all face the challenges that we're facing right now. And just wanted to, point out the importance of social emotional health, which I think we'll be talking about today as well for our communities. Very important and very connected to our physical health as well. And just to thank our hosts, APAL, API, Building API Community Power. We have EBASI, East Bay Asian Youth Center, our AAYSP partners, American Association of Yemeni Students and Professionals, Bante Sere, and United Methodist Tongan Mission and Laurel United Methodist Church. So thank you so much for helping to co-host this event. And I'm going to go ahead and turn it over to Santoy Trotter, who is a school-based behavioral health, trauma-informed systems coach and trainer at UCSF Benioff Children's Hospital in Oakland.
Thank you, Ms. Hewen. So glad to be here with you, Oakland, today. We are here to talk about COVID and school safety. And as Ms. Huen shared, that safety means physical safety, emotional safety. I'm here with my colleagues, Dr. Emily Frank, who is both a UCSF pediatrician and a teacher at Life Academy here in Oakland, and also Dr. Sohail Sood, who's an associate professor at UCSF School of Medicine. And we're glad to be here with you today. Next slide, please. And we're the faces and the voices that you'll hear today, but we really want you to know that we are part of UCSF Pediatric Advisory Task Force members, and all the people that you see here have put thought into the presentation that you're here today, have been part of the collaboration to ensure that you have the best and most recent information that you can have today. Next slide. So we want to start with a few important reminders. So our goal is to partner with you, OUSD families, your students, teachers, and staff, to provide the most accessible, trustworthy, scientific information to reduce COVID transmission risk. We want you to know that we are independent medical providers here to offer our expertise and support for a better understanding of existing data and guidelines. We know there's a lot of information coming in the news, in the internet, and we want to give you the most up-to-date information so that you have that yourself. This presentation addresses how to reduce your risk when schools reopen, not whether or when schools should reopen. And new data is coming out constantly. So what might be true today can change tomorrow. And so we updated this presentation last night. So you have the most up-to-date data, and we'll share that with you today. So our agenda today is starting with health equity and COVID, really thinking about how COVID impacts different communities and their access to healthcare. We'll talk about COVID transmission, how to reduce the risk of COVID, and also have some time thinking about the vaccines and variants. And throughout the agenda today, we will have time for you to be able to ask questions to our different presenters. So please stay with us for the whole time. Make sure, write down your questions if you have them, and put them in the Q&A if you see at the bottom of your Zoom. We want to remind you or let you know about the values that we are coming to you with. We know that as a community, we have values, and for us as an advisory group, we want to root in the value of transparency. We're going to share with you the information that we have, and also be clear about where we don't know answers and what we don't know. We'll be clear about who we are, and if we're talking to you as a role as a doctor or a mental health professional, or when we're talking to you as a role as a parent or as a community member. We value the safety of everyone who touches Oakland schools. And so that might be the third grade student who just is about to finish up the semester, the mini semester. It could be the janitor who opens up the school at 5 a.m. or 3, in the mornings, or the principal who is usually at the school building to 7 o'clock at night, and everyone else, teachers, paras, restorative justice facilitators. We are here thinking about both physical, emotional safety for everyone. We also acknowledge that communities are impacted differently and have different access to healthcare and education. And we were thinking about that as we are sharing this information, thinking about the impact tonight specifically on Asian Pacific Islander, and Muslim communities as it relates to COVID and COVID-19 health and wellness. We are here in collaboration with you, community, to think together, and to give you information that will empower you, this district, to make the best decisions for families, students, and staff. And we believe in recovery and resiliency. And I appreciate just naming my heart is feeling so much love and care for our Asian and Asian Pacific Islander communities, given the recent incidents of violence on elders in particular. And we know that together we are here in solidarity, and we will be in resilience and create safety for everyone in our communities. The image that you see here is a painting that was made by Kadir Nelson, a year ago, last March, at the beginning of this pandemic. And he intentionally wanted to create an image of all of us together, right? To remind us of the closeness that we have in our community. And one of the things he put into this painting is that we're all facing in the same direction, looking towards the light. And we are here, a year anniversary of this global pandemic, but we will work together to make sure that our students, our families, our community continues to restore and access to school, to education, and to be safe together. Next slide, please. So in terms of COVID-19, what we've seen this past year is an illumination of the impact of structural racism on health for communities. COVID-19 didn't bring that, but it also helped us as a nation and as a community to really wrestle with and to acknowledge deep-seated barriers to healthcare and ways that communities are impacted by health differently. And so we're going to talk a little bit about that today. Next slide, please. In the spirit of our transparency, we want to acknowledge that racism is also embedded in the medical system, and that communities have been impacted by medical abuse, and that there is a mistrust of healthcare systems and medicines that stem from historical and ongoing experiences of abuse and self-harm. That many people are worried and concerned and don't know if they can trust the information that they're receiving. We know that poverty and education gaps and housing instability and lack of healthcare put racial and ethnic minority groups at higher risk of COVID, higher risk of both contracting COVID and also dying from COVID-19. And some of the strategies that have been put in place that we needed for our physical safety have harmed or impacted communities unintentionally. People are not able to go to work, or if they're working, how do they care for their children at home? Increased stress, the impact of isolation and loneliness. So we're all mitigating, navigating many risks and choices 12 months later, and that there is an impact on our health and well-being in some communities. Especially communities of color, Asian, Pacific Islander communities, Muslim communities are impacted in a greater way. Next slide, please. So we want to take a moment that on top of the global pandemic and the things that I've just shared, that we as a community are coming to a reckoning of increase in hate crimes towards Asian and Asian Pacific Islander communities. And some of that is coming from misinformation and name calling that came from the tops of our government a year ago. And we've seen an increase in a rise in anti-Asian hate crimes. And I know that our communities are coming together in solidarity, but we are aware that over half of the hate crimes that have been reported have happened right here in California, and that 708 were reported in the Bay Area alone, and particularly in San Francisco, San Jose, and right here at home in Oakland. I know that I was overjoyed to see actions happening in Oakland and San Francisco of communities coming together to say, not here, not in our home, that we will protect each other and come together. And so we know that our communities are hurting, and we want to really express our solidarity that we have your back, and we are absolutely committed to safety and well-being of our and your community. Next slide, please. And we might be thinking, so what can we do, right? What can we do already with so much isolation that we have? And then on top of that, level of fear. And so just a few, this is not, exhaustive. This is not the only things that we can do as a community, something to tell it might be something that you're telling your brother or your grandmother or your daughter or your friend, but your safety is what's most important. So if you are in an experience where you're feeling unsafe, trust your instincts, trust your belly. Right? Notice what your belly feels. And if you feel worried or scared or unsafe, that's a time to get up, to leave, to call somebody, get someone on the phone, talk, to get next to someone 6 feet away, but get in connection, stay calm. So I invite everyone just to notice their breath right now. Notice your breath coming in your nose. Feel it filling up your lungs. Breathe out. That's a way to, when we get scared, to come back to our full brain and to come back to a place of being calm. So be able to do that. Limit eye contact if someone is in your vicinity and it seems like they're not safe, and maintain neutral body language. Walk away, speak out, speak loud if you need to, or speak in a calm voice. Seek support. And most importantly, seek emotional support. Once you're physically safe, sometimes we can feel shame if we were at risk or if we were scared or if someone hurt us. But that shame, as much as you can acknowledge it and still seek support, help, let somebody know. A lot of the organizations that are sponsoring us here today, EBASI, APAL, are great resources for help and support in our community. Next slide, please. We know also here in our beautiful Oakland, this is a picture of different neighborhoods. And if we took out that, we would see lots of trees and greens and cities and homes. Each of these neighborhoods is someone's home where someone's family is living. But our communities are not impacted the same, right? Our neighborhoods do not have the same impact for COVID-19, and our neighborhoods that are more impacted by poverty, and some of that poverty often is due to historic racism, are communities that have the highest rates of COVID-19 transmission, of COVID-19 transmission, and also highest rates of death. And this includes our Asian Pacific Islander, Muslim communities. This includes our Black and Latinx communities. Our communities of color and our communities impacted as well by poverty are the communities that are impacted the most by COVID-19. So we want to be as thoughtful, hold this data well as we're making decisions to support the safety of our communities. Next slide, please. We want to leave this part of the conversation with someone who, Dr. Nunez-Smith, who has been thinking about this, staying up at night, thinking about families, thinking about people of color, thinking about safety and health. And we know at the beginning of this pandemic, we had lots of different information and different levels of knowing. But that misinformation impacts communities that are most vulnerable, who are already suffering the most. Our commitment to you families, our commitment to you teachers, staff, Oakland Unified School District, is to give you information that is factual, that is true, that is based in science, so that you can make the best decisions for your family and for your community. We also want to speak to mental health. And I know that Asian Pacific Islander families are, and most likely Muslim families as well, are 2 to 3 or 4 times less likely to seek mental health services as white communities. I know in my own community, there's a saying of like, keep things inside, don't talk about it, don't share your stories. But what happens then is that if we're not talking about our mental health, if we're not actually talking about our emotional health and doing things, the concern is depression, risk of suicide, and that the mental health illnesses are impacting our children, our families, our communities. And so we have an opportunity as we heal ourselves to heal this generation, to heal back and forward. And that's what we want to encourage families and us to do today. We know that racism, discrimination, grief and loss, all of these things are impacting our mental health and our well-being. Some things that you can do, you might be thinking, what can I do? Is talk about your experiences. We've talked about talk, draw, write, sing, play a drum, cook some food, do something that expresses your inner emotional experience. Be able to recognize our emotions, right? And name them for ourselves, name them for our children as much as we're able to. Speaking our emotions out loud actually helps us to regulate our emotions. As much as we're able to, stay in connection with friends, with classmates. And, you know, we have to get creative about this, right? Whether it's being Zoom or now that spring is here, it may be meeting outside 6 feet with mask, but being able to be in community. Keeping a structure and routine is actually very helpful. We want to be flexible where we can, but we're still, you know, getting up, taking a shower, getting dressed for work or for school, in any ways that works, right? Having some routines, going on a walk or exercising every day, even at the same time of day. Right now, I just sent my family out on a walk as I'm here speaking to you. So getting some sunshine, some vitamin D, exercising, and connecting to something bigger. That might be a cause or a mission. It might be spirituality, a church or temple. But connecting to something that gives us hope and reminds us that we are a part of something. It could also be a community group. So those are some things, but I'm happy to talk with you a little bit more about some of the things that are possible. Next slide, please. We want to give a chance to, I'm going to pass it to John Sasaki.
Thank you, Ms. Trotter. I think first and foremost, really, you know, after having been in this situation for, you know, almost a year now, and during the course of this time, things have kind of built, and you know, the frustration maybe has grown. What do you see, or really, what should families look out for among their kids as far as symptoms that things aren't really going well, and how are they manifested differently in younger kids versus older kids?
Right, thank you for that question. For younger kids, some of the things we want to look at is belly aches, so we can hold our feelings and our emotions, even for older kids, in our bodies, especially if we're not used to talking about it. So it might be a lot of complaining or belly aches or nightmares, not being able to sleep, or sleeping most of the time. You know, if you have a teenager, you might think, oh, my teenager, you know, they're growing, and they are. But if you see them sleeping most of the day, multiple days out of the week, that's a time to be concerned. Also, if you see emotions like an anger outbursts or kind of high highs and low lows, so kind of being very, very happy, or lots of energy, and then a crash, moving very slowly, sleepy, being disconnected, not talking to friends. Parents, you know your children. So one of the things I want to say to parents out here is, if you're noticing a change in their behavior, right? If you're noticing that they're not like themselves, whatever that means, that's a time to talk with them, but also talk with someone, you know, might be a time to check in with a mental health professional. And we are doing therapy through telehealth, through Zoom, through groups, and it's a good way to connect. But those are some of the ways, some of the things that we see.
Yeah, and you know that we have heard from some families who say things like that, you know, they're concerned about their child because they've been so isolated. They've been away from their friends. They've been away from people really just in general. So there have been times that they've been able to get their kid around other kids, and it hasn't really gone well. Like the kids get upset, maybe a little outbursts. You know, a child that is normally a pretty joyful, happy kid in this new environment after, you know, being in this situation for the past year, it didn't go quite how they expected. What should be expected in those situations, and how do you deal with it?
I can only imagine, right, that a parent's taking the time to set up a play date or a park date or playing where it's actually going to happen. And then you get there, the parents are all excited, and you get there and the child doesn't want to be there, might be hiding behind the parent, or might be irritable and upset, and I just want to go home. And I just want to remind people that we haven't been around a lot of people. Not as many people, even if you're going to work in spaces, not as many people as we're used to. And so it's going to take time getting used to being around people again. As a therapist, we talk about exposure. And sometimes we have to expose ourselves to things that may cause us a little bit of stress or anxiety or nervousness. And so for those first visits or outings, keep them short. Keep them very short, 30 minutes or less, right? It's just kind of, we're getting out there, and talk to your children when you get home. How was that for them? Do they want to do it again? Especially for the younger children. But, schedule another visit, but keeping them short so you're not expecting too much out of your child. We're all going to have some social anxiety when we get back in that school building. So whether you're a teacher, whether you're a therapist, whatever your role is, there's going to be some getting used to being around people again. I think one last thing I want to say, John, is that it may also take more energy to be around people. So even if you're enjoying it, you might go home and realize that you're tired. And oftentimes for children, when they're tired, they get irritable. For adults, when we get tired, we get irritable. So noticing that social interactions will take more energy when we start doing that more frequently again.
Yeah, and that by the way, that question came from a family member here in IUSD. So we're seeing it. It's real. It's there. And I would imagine one good thing about this is that nobody's alone in this, right? You can kind of feel like in your own little cocoon, you're going through this, and it's like, I mean, obviously we are all experiencing it differently, but this is what everybody's going through. I mean, this is kind of universal. Just like you said, I mean, you admitted that you could have some social anxiety coming back into the real world after being in this situation for the past year.
Absolutely. We're all going through this, and it's impacting us differently, right? And I want to acknowledge that in thinking about resiliency, right, as one of our values, that for some children, especially for children that might be a little bit shyer, a little bit more withdrawn, that for some children and students, like, this might be working just fine for them. It might be working better for them, right? What do we need to learn from that? That families and children are experiencing this time differently. But we are absolutely, I think, we are, is it the 13th? No, I remember a year ago, Friday, I think it was the 13th, when we got the call that schools were going to close, right? We all remember that moment. And we thought it was going to be 2 weeks, and now it's been a year. And we're all in this together, and we'll get through this together.
Of course, it was Friday the 13th. Yes. All right. Ms. Trotter, thank you so much. I think it's time we move on to COVID and the way things are spread and how we deal with this as a community, as a family, as an individual. So how about we bring in Dr. Frank?
Thank you so much. Thank you, Ms. Trotter. I always learn a tremendous amount from you. Hi, everyone. My name is Dr. Emily Frank. I am a pediatrician and also a teacher at Life Academy. For this next segment, I'm going to be reviewing COVID transmission and helping us think about what might a safer school look like in this era of COVID. Next slide, please. So to be able to frame this as best as possible, I want to make sure we're all on the same page about how COVID is transmitted. And we've learned a lot in the past year about this. And so COVID comes from the SARS-CoV-2 virus, and it is most frequently transmitted by droplets. So droplets are large wet particles. We can feel them if we put our hand in front of our mouth when we breathe and when we speak. And most of these particles fall within about 3 feet of us. That's the primary way that COVID is spread, if those particles get into the eyes, the nose, or the mouth. A much less common form of transmission is aerosol. So aerosols are these teeny tiny particles that can stay suspended in the air. We can generate these when we cough or when we sneeze. Another less common, much less common form of transmission, in theory, is surface transmission. So if I accidentally spit on my keyboard, somebody touched that, and those droplets on that keyboard, on those fingers, got into the eyes, nose, and mouth, it is thought that that can also transmit COVID. But the most common way is through droplets. Next slide, please. Again, the droplets have to get into your eyes, nose, or mouth to cause infection. Next slide, please. So a high-risk exposure is an exposure of close person-to-person contact. And so this is within a 24-hour period, being within 6 feet of an infected person for more than 15 minutes. Walking past a person with COVID is not a high-risk exposure. Being in close proximity, meaning within 6 feet for more than 15 minutes, is what we would consider a high-risk exposure. Next slide, please. So as we talk about what a COVID safer space might look like, I think about prevention in a few different chunks. So for a virus to be successful in infecting another person, the virus particles need to leave the infected person, they need to successfully travel through the air, and they need to come into contact with the face, specifically the eyes, nose, or mouth of an uninfected person. Next slide, please. And so as we talk about different interventions to reduce the risk of COVID transmission, we'll be thinking about interrupting each of these steps that the virus must take to infect another person. Next slide, please. So what I want to do is give you a framework for risk reduction. How can we make our learning spaces, really any spaces, as safe as possible in terms of reducing COVID transmission? And my goal is to get you to start thinking about what might that look like for our students, our staff, our teachers, all of the members who are part of the school community. Next slide, please. And so as I explain this, I want to explain it through this idea of the Swiss cheese model. And so this is a model that is not unique to COVID. It is used by those who develop cars and other sorts of machinery. And the idea is this: no single layer or slice of cheese, by layer, I mean layer of protection against COVID, is perfect. None is perfect. There is always a hole. However, if we layer slice on top of slice, on top of slice, on top of slice, then what we are able to do is make the risk of infection lower and lower and lower. And so on this slide on the left side, you see an infected individual. On the other slide, you see a person who is not infected, and each layer of protection that is used can help reduce the risk that this uninfected person would get infected if they came into contact with someone who had COVID-19. Some of these responsibilities we can each take responsibility for. They're personal, others are shared responsibilities. And so many of these layers are already familiar to you. I'm going to review them and help give them context as to what that might mean for school spaces. Next slide, please. So this is a message we've heard again and again: stay home if sick, all right? Before even leaving the home, screen yourself, your loved ones, your children for symptoms. If anybody in the family has had symptoms in the past 24 hours or is waiting for a COVID test due to a concern for COVID, they should not come to school. Additionally, if anyone has had a high-risk exposure, again, that's within 6 feet for more than 15 minutes, it's important that they stay home. Typically, in adults, we think of COVID symptoms as fever and chills and cough. And while I want to point out that children can have those symptoms, COVID can also look very different in children. It could, for example, just be a headache or a runny nose or some diarrhea or loss of taste and smell or a sore throat. And so it's really important that we're focusing in on any new symptoms that have arisen. I want to acknowledge that there are many children who have chronic illnesses that cause chronic symptoms. And in these cases, it's really important to talk with your doctor and school team to make a plan for symptom screening. Next slide, please. So going to school, what might that look like? Perhaps before everyone gets ready for school for the day, we're using some sort of screener. I put an example of the one that I use for my medical work, where whenever I go in for a shift, I get screened. This might be a way that screening would get done before getting on the bus or before catching a ride or before walking to school. This is just an example, but to get your mind thinking about what that might be like. Next slide, please. So physically distancing, you've heard again and again, you've seen those cones marked in the grocery store and in other places. Certainly this is something that will be an important layer at school, particularly for the older age students. The point that I want to make is, where does 6 feet come from, and is it absolute? And the answer is, it comes from this idea that most of our droplets fall within 3 feet. And so we doubled that to be safe to 6 feet. 6 feet is a guideline. It is not an absolute. If we cough or sneeze or scream or are doing exercise, those droplets can go a lot further. And so it's important that we think about what we're doing and use that as a guide for how much we space ourselves. Next slide, please. So what might that look like? Well, desks might be kept further apart. Cues might be placed on the floors of the hallways or signs in the school to help us remind each other to space. Next slide, please. Masking. I don't think I need to tell you that masks are important. What I want to do is point out a couple things of different types of masks. So there are cloth masks, surgical masks, and N95 masks. N95 masks are more specialized, and they're most appropriate for prolonged close exposures, and they're best if fitted. Recently, we've learned that placing a cloth mask over a surgical mask gives protection near to that of an N95. I do want to draw your attention to the picture on the right of the valve N95. These were designed for situations like smoke from wildfires. And they're very good at keeping the outside air away from you. But the problem with the valve is that it's a one-way valve, and what's coming from you gets streamlined out. And so N95s are, valved N95s should not be worn because they let the particles escape out. So no valved masks is really important for COVID safety. Next slide, please. Another message we've heard again and again and again is hand hygiene. And I want to put this into context for you. The whole point of this is to not get virus particles in our eyes, nose, or mouth. And so the idea here is, if we, even if we are coming in contact with COVID particles, we can protect ourselves by making sure we're washing our hands before that virus could come into the eyes, nose, or mouth. Hand sanitizer is a fine option if soap and water are not available. Washing with soap for at least 20 seconds is really important. The water does not need to be hot. Cold water and soap is perfectly adequate for hand hygiene. And then, there's been a lot of emphasis on deep cleaning and frequent surface cleaning. And while there are sort of spaces for this to happen, regular hand washing is really going to be our first line and most important form of prevention. Next slide, please. Another layer of Swiss cheese is making it harder to touch the face. And so in these pictures, you can see a face shield, and face shields are helpful for protecting our eyes. They're also helpful for reminding us not to touch our face. But a face shield is not the equivalent of a mask. It does not provide the same protection as a mask. And so if someone is wearing a face shield, they should be wearing a mask as well. Next slide, please. Slide 6 is about cohorting. And so what a cohort is it's a set group of students or people that are together and in proximity to each other. There is no magic number for the size of a cohort. There's no recommended number. The size of a cohort should really be based upon the size of the space they are occupying. The idea behind a small stable cohort is that each member of the cohort is exposed only to a certain set of people, and this can reduce their potential exposures. Were there to be a positive exposure, it is much easier to trace who someone was in contact with and more easily to contain and quarantine if we have small stable cohorts. I believe, next slide, please. Yes, I believe I'm going to pause here. And I'm not sure if we wanted to do questions or if I should turn it over to my colleague, Dr. Sood, to talk about some of the remaining slices of cheese.
Let's go ahead and move
Forward
forward.
with the remaining slices of cheese.
That sounds great.
Great, thank you, Emily. Hello, Oakland. My name is Sohail Sood. I'm a UCSF pediatrician. Very glad to be with all of you today. Slide 7 is about testing and contact tracing. So there are 3 types of ways in which we do testing and trying to identify who got COVID, where they got it from, and trying to identify and break that chain of transmission. The first type listed here is symptom-based testing. So this is when, as Dr. Frank was mentioning, you're screening your child at home and you come into a situation where you feel like there's a symptom that this child has, whether it's a new fever, an unexplained headache, a sore throat, certainly loss of taste or smell. That's when you would seek, professional care from your physician to consider getting tested for it based on those symptoms. The other situations are in which you might be exposed to someone who had COVID. And that's where that previous guidance about being within 6 feet of someone for more than 15 minutes comes into play. And if you're in that situation and then later come to find out that that person may have had COVID, that's a situation where most public health experts would recommend you quarantine yourself and then go ahead and get tested to just confirm that you didn't happen to catch it. And then the final type of testing, which is of consideration in a number of school settings, is the idea of monitoring testing, which is regular testing to really detect if you might have asymptomatic infection. So you might have COVID and have no symptoms or no known exposures to it. And that's in part because the data from the CDC suggests that up to 40% of people with this virus show no symptoms of it, and they are still able, although to a lesser degree, able to transmit it forward. Next slide, please. Okay, and with regard to ventilation, from an infection prevention standpoint, I suppose I would start by saying the very best place for all of us to be right now is outside. The outdoors are significantly safer from an infection prevention standpoint for the transmission of COVID-19 or really any respiratory virus. I say that knowing that being outside is not the same for everyone, particularly from a safety perspective or an air pollution perspective. So I know that's not always easy, but certainly from an infection prevention standpoint, it's a great place to be. Reasons for that. So number one, there's less high touch surfaces outside. So we come into contact with less things that may be contaminated with infectious particles. Number two, it's typically much easier to physically distance. So it's much easier to keep a solid amount of space between people. And number three, if you're outside with someone who has COVID-19 and they cough and they sneeze or they get viral particles out into the air, the amount of virus that would hit your face would be so incredibly diluted by just the vastness of that space. So less virus is going to hit you if you're outside sharing the air versus in a closed space where there's not much air movement going on. And then the fourth reason why being outside is great is sunlight, actually. It's been shown to have some degree of germ-fighting powers. And in fact, the CDC is recommending different forms of ultraviolet germicidal irradiation, which is somewhat, kind of related to sunlight as a way of helping treat the virus in facility type settings. And so, that's all the good stuff about being outside. But I recognize that's not always possible. And so if you're inside, really, the way to think about it is how much can we make the inside like the outside? And that's what ventilation really is. And, that's where we talk about opening doors and windows. And I would just emphasize that those are not trivial little things. They make a huge difference to the circulation in the space. Anybody that's been, indoors on a cold day and you just crack the window open a little bit, the inside gets cold pretty quick. That air circulates pretty fast and gets in there. So the more we can open up doors and windows when it's possible to do so safely, it's a really great tool to make the inside much safer. And then finally, if you can't do that, if you can't really focus too much on ventilation, then the final technique in this area of indoor air quality is basically filtration or air cleaning. And that's where you may hear words like the portable air cleaners or HVAC systems, ways to circulate air within a space, but pull out the viral particles into various filter type mechanisms. Next slide, please. So I think we'll stop there for a moment. I'll turn it over to Mrs. Sasaki and see if there's any questions on viral transmission.
Great. Doc, what would you say is the most important form of screening?
I'm sorry, you mean like what questions or what symptoms to ask? And Dr. Frank, feel free to jump in too.
That is how for our purposes in schools, what is the best way to keep really on top of the entire situation across the district because you listed all these different kinds of screening, forms of screening. So what really is going to work best in this kind of environment, do you think?
I think one of the key pieces to that is education and making sure everybody understands what we're looking for and when to not come to school. So I think that's one of the most important pieces. And then, I think ideally, if it can be done electronically where people are able to use their smartphone to screen and that data can be consolidated, I think that's helpful. I don't think it's the only way, but I think it's one way that might help with lots of data on a daily basis.
And so, one of the challenges, of course, we're going to face when we do come back to school is, kids who have a runny nose because they have a cold or because they have allergies. So how do families navigate that challenge? Because these days everybody thinks, I've got a little sore throat or I've got a headache. Oh, I must have COVID, right? So that's kind of the automatic response that people have. So how do you differentiate between all the possibilities?
Great question. So my work is in pediatric urgent care, and we have to get ourselves out of the mindset of it's just a runny nose or it's just a headache or it's just my allergies. If anyone has new symptoms, they need to stay home and communicate with their medical provider before taking next steps. Used to be no big deal to go to school with a runny nose, and we can't do that anymore until we know that it's not COVID. And so any new symptom or any exposure should prompt learning from home until you've had a chance to check in with a medical provider or get a negative test.
And I mean, I think that, like you said, I think a lot of families have, been in situations where they didn't think it was that big a deal. I'll just send my kid to class, everything's okay. And then they get there and they're not feeling well. And so then they get called and go home. So what really is it just simply anything that's out of the ordinary that they should look for?
Yes, because in kids, the presentation of COVID is so variable. And so anything that is new within the last 24 hours should prompt staying home. And I know this is tough. I know that we're not used to this. All the time, I used to teach with a headache or a sore throat, and I can't do that anymore because I need to look out for the safety of everyone around me.
Great.
It's going to be an adjustment. It's a different way of thinking about how we go about our lives. And it's going to be a really important one for us to be successful in what we're doing.
Great. Leilon, did you have a question there as well?
Yeah, I know we've had parents ask about, ventilation and air purifiers. I believe that we're investing in that for classrooms. So I'm just curious, kind of how effective are these air purifiers, that people are buying for their homes that we had to buy for the fires and the smoke and everything in getting rid of COVID-19 particles?
Yeah, great question. So I suppose I'd start by saying not all air purifiers are the same. So you really want to look at the fine print. I'm trying to think off the top of my head a good website to go to. Well, one place to start would be, of course, the CDC, and starting there. Another place is called ASHRAE, A-S-H-R-A-E. That is the Association of Heating and Refrigerating Engineers. And they work, part and parcel with the CDC to help develop some guidelines around this. But when you think about air purifiers, you have to think about how much air is coming in and the space itself too, and what type of filter is part of it. So it's about making sure that you have a filter that is of a high quality, and that the amount of air that can circulate through that particular machine can cover the appropriate square footage of the room. So those are the factors to consider when contemplating whether or not to purchase one.
If I can actually share a little bit of information on what Oakland's approach to this, because I think it is a complicated and specific question. So we've been working with the Lawrence Berkeley Lab, in indoor air engineers, which probably is not their official title, but you get the idea. And there's a Harvard Healthy Buildings initiative, and as well as the ASHRAE that you mentioned before. And the two things you sort of looked at was the air exchanges, and that the standard, I believe, is maybe 4 to 6 air exchanges, meaning like all of the air is being filtered continuously 4 to 6 times, I think, an hour for that time. And then they made sure that the HEPA filters, or that the filters they got, were effective with particle size for COVID-19. And I think that was the standard that they're looking at is, I believe, 2 air purifiers per teacher in the classroom, given the size of the, sort of adjusted a little bit to the size of the classroom that you're at. So that's sort of like the general approach they've taken so far.
We have a question from one of our participants tonight who says, one concern we have about opening schools is our children are asymptomatic and bring the virus home. We've noticed that when kids gather, they don't think about COVID, they just care about being kids, so they don't take precautions. How much should be worried about that risk? Because, I think it's been fairly established that kids don't really manifest the symptoms in as significant ways as adults. So how do you watch out for that when kids come home?
That's a great question, and I'm really glad it was brought up. And it's a really important point that many people, and especially children, can have no symptoms at all when they have COVID. I want to answer that question in 2 parts. The first is good news, which is that young children are really not that good at transmitting COVID. They're only about 1 in 3 times as likely as adults to transmit COVID. And this is for children who are ages 10 and younger. For that middle school age, the data hasn't really been stratified that way. And we know that older children transmit in a pattern more similar to adults. The reason this is helpful is many younger children may have a harder time sort of spacing and distancing and following precautions. And as children get older, many of them are much more able to adhere to these safety measures. So that's the first piece, is it is more likely for children to get sick from an adult than to give COVID to an adult. And this is quite different from many other illnesses. So it's a new way sort of thinking about it. But I think particularly in thinking about elementary age children, that's helpful. The second piece is really bringing it back to the Swiss cheese model. And the reason that we use so many layers of protection is in case one isn't there. Maybe there's no distancing. Hopefully, then we can rely on ventilation and hand washing and masking to help keep safe. Or perhaps the mask comes off, But if we are spaced and outdoors and again, hand washing before we touch our face, those many layers, every single layer helps contribute to reducing transmission. And so that's the reason for wanting to put so many layers into place. I think we'll hear about vaccines later, but this is the reason that we're going to continue practicing all of these other safety measures, even as more and more community members become vaccinated.
How do we know the surface transmission is less important now than we thought it was in the beginning? I mean, if you remember back in the beginning, we were all like picking up our groceries and wiping everything off, when we get it home before we put it away, and washing our hands, making sure that we've cleaned everything that we brought into the house. So how do we know now that it's not as critical?
You're right that it's very hard to tease apart some of that data. Anybody who is within 6 feet of somebody else may be sharing the air or maybe sharing surfaces with these individuals. But from a transmission perspective, I would say a few things. So one is this coronavirus can cause lots of problems for us, but it's very easy to eradicate with basic cleaning principles. It's incredibly susceptible to soap and water. There have been studies done with viruses similar to it, where you could even dilute the hand gel down and it would still eradicate the amount of virus too. And then in addition to that, if you think about the full chain that needs to happen for someone to get sick from touch, the virus needs to survive on a surface, and it doesn't do that for very long. Then someone needs to touch it and transfer it onto a finger. And that actual transfer efficiency onto a finger has been studied and doesn't happen very much. And then that person needs to touch their face, and that also decreases. So incrementally, each of those steps in transmission has a lower likelihood of actually passing the virus all the way across that chain, that it makes it far less likely to be the case.
Great. One thing I've actually personally wondered is, people who've gotten to this point in this fight against the pandemic without having caught it, and as we've talked about, the numbers have varied along the way, but it's been argued, at least like during really the height of the pandemic back, a couple months ago, that 1 in 5 people that you're around potentially has the coronavirus. So if you've reached this point, do you feel pretty good that whatever a person has done to that point is what they should continue to do moving forward, because it's worked thus far?
That's a tricky question. I think there are things that all of us were doing in the beginning, right? Like wiping down our groceries, or, I was changing my scrubs at work before going home and wiping down my car. And I think that we've learned over time about the things that are most helpful for protecting us and the things that we don't really need to be doing. We don't need to wipe our groceries down. We need to wash our hands.
Yeah, I agree. I mean, in part, it depends on what you've been doing so far. And some people have been doing maybe more than they need to. And other people have been doing things and maybe getting by even on chance, right? So it's very hard to answer that question more globally, because it also depends on the level of community transmission. And hopefully we continue to march down these tiers and march down in rates, but should we pick back up, sometimes it does mean that each of us need to take a slightly higher level of precautions.
So then in a nutshell, what should people be doing right now to protect themselves from the coronavirus?
Stay home if you're sick. Wear a mask. Space when possible, and wash your hands before you touch your face.
And are you, sorry, one side note, are you recommending double masking? Because that's been a lot of the talk recently too.
The CDC is now recommending double masking. And in general, the idea is more layers are helpful. So if you can double mask, that's great. That's excellent protection. If you cannot double mask, try to use a mask with more layers, for example, a 3-layer mask.
Great. Last question from one of our attendees. Any updates regarding variants transmitting more effectively in children, such as the one from Italy, Israel, Hungary, et cetera?
So
This is a great transition to our next section.
exactly.
Perfect. All right, next up are vaccines.
Perfect. Yeah. So I'll start by speaking a little bit about vaccines, and to the person who asked the question, we'll discuss a little bit more on variants toward after the vaccine section. And you go ahead and move to the next slide. Thanks. And I think for the purpose of time, let's go ahead and skip one slide forward. There's a lot of great news on vaccines that we actually didn't have time to update the slides, but I'm happy to tell everybody about them. And I don't use the word lightly when I say I truly believe these vaccines are life-changing. They're a huge step in the hope and the promise of where we need to go. As most folks know, now we have 3 options for vaccines here in the United States. It's commonly known as the Moderna, the Pfizer, and the Johnson & Johnson vaccines. The Moderna and Pfizer vaccines are formulations that are based with mRNA, and the Johnson & Johnson vaccine has genetic material that's basically inside another virus that is not COVID and does not cause illness in us. But they're all ways of telling our immune system to mount a response to something that is on the virus that causes COVID. And the studies on this were truly demonstrated significant efficacy. They were really, really fantastic results that I think pleasantly surprised the whole world. I'll read a direct quote from the CDC page on this. No participants who received a COVID vaccine died from COVID-19 in all 3 trials, looking at all of those 3 vaccines. Again, no participants who received a COVID-19 vaccine died from COVID-19 in all 3 trials. And there was near perfect protection against hospitalization as well. And so because the efficacy of these vaccines are so great, as most folks know, this week the CDC eased restrictions on gatherings for those who are vaccinated. And vaccinated, of course, means 2 weeks after your second dose of the 2-dose series of vaccines, and then 2 weeks after your first or your single dose of the Johnson & Johnson vaccine. And so for those who have reached that state, which hopefully soon will be many of our educators too, they are, per the CDC, allowed to visit with other fully vaccinated people indoors without wearing masks or physically distancing, and visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease indoors, also without wearing masks or physical distancing. Next slide, please. Thanks. So that's about the efficacy. Now to vaccine safety. I'll start by the last numbers I looked at yesterday, I think showed about 18% of the United States population has received at least one of these 3 vaccines so far. So that is, a fantastic news, and I think speaks some degree of safety. If there were major alarm bells at this point, we may be getting a signal even outside of the trials that suggests that there may be issues. But the other thing I'll point out is that all of the vaccines went through all of our typical regulatory phases of clinical trials. So they were vetted very thoroughly along that front. And in fact, the reason the results of some of these trials were not available until after the November election was because the FDA specifically wanted to wait at least 2 months to gather 2 months worth of data on vaccine safety prior to making any decisions about it. And that's because if you're going to have a reaction to a vaccine, typically that's going to happen within the first 2 months. So they wanted to make sure that the vaccines were safe. Safety was a paramount consideration from the beginning. Where the speed gains were made were on the production side. So, large amounts of these vaccines were manufactured even before knowing whether or not they would be allowed to be used in the population overall. Now, that doesn't mean that there are not side effects. Listed on the right here are the more common side effects. And I can personally attest they happen. If I go up the chain, me as a healthcare worker, I have been vaccinated. I had a sore arm. My mom, who's pushing 70, she had fevers and chills and was down for a day. And my grandmother, who's pushing 90, she had nothing. And so all of the above can happen and does happen within the population. And I would say more likely than not, most people are going to experience one or two of these milder side effects that are short term. Next slide, please. And so, you know, there are certain populations that we're still learning a little bit more about. So if you're pregnant or breastfeeding, the recommendation is to talk to your doctor because there are things to consider in that situation. I'll say, you know, me as a person and as to my friends and family who might be pregnant or breastfeeding, I am recommending the vaccine to them. But I certainly recommend that everyone talk to their doctor before making their decisions. And then if you're taking medications that suppress your immune system, or if you have a history of an allergic reaction or anaphylaxis to food, that's another reason to talk to your doctor prior to proceeding. The true medical contraindications for the vaccine are the two that are listed there. So a history of an allergic reaction to any ingredient in the vaccine itself, and all of the ingredients are listed on the CDC website. Or if you got the first dose and had a severe reaction, then certainly, you know, it's a reason to consider not getting the second dose too. Move on to the next slide. So can kids get the vaccine? Unfortunately, not yet. The Pfizer vaccine is, well, it's the only one of the three that is licensed for the age of 16 and above. The Moderna and the Johnson & Johnson ones are under emergency use authorization for ages 18 and up. I'll note the Pfizer study actually enrolled children as young as 12 in their original study, but they just didn't have enough cases of COVID in both the vaccinated or unvaccinated arm to detect whether or not the vaccine was making a difference. So for now, it's only a license for people over the age of 16. All three companies are doing trials as we speak in children as young as 12. And so hopefully we'll get more data as time goes on to be able to know whether the efficacy data and the safety data bear out the same way as they have for adults. But those are still going on. And the other thing I'll say is that roughly 80% of this country is over the age of 18. So if you can picture, if we can get most of the adult population vaccinated, we can reach herd immunity and we can maybe stamp out this virus even prior to getting children vaccinated. Next slide, please. And, you know, as has been mentioned, vaccines are just one slice of this, you know, prevention, a hugely important slice. But when the studies were done about the vaccine, they also showed that while it was incredibly protective at severe disease and death, there were cases of mild disease in people who did have the vaccine. So clearly there can still be some degree of infection and presumably some passage of infection, so some transmission, although that's very likely to be very minimal. But until we vaccinate more people and until we really move toward eradication, all of the other slices, all of the other measures are so important. And, you know, and to this population in particular, Asian Americans and Pacific Islanders, of which I am one. I have roots in Malaysia and in India, and my wife is from Taiwan. I recognize the importance of family, and for many of the connections we have to people in other countries. And so this is just a plug that we really need to support global vaccination efforts, and we should really think of equity on a global scale. But even if you don't, the U.S. isn't an island. And so, you know, for our relatives and communities throughout the diaspora, really everyone in every corner of this globe needs access to a safe and effective vaccine. We can move on to the next slide. So about the variants. What is a variant? So a variant is essentially a version of the virus that's slightly different from the original version, because usually a mutation in the genetic structure of the virus. And in this case, the mutations that we care about that seem to be causing some transmission changes are those that are related to the spike protein. And you may have heard that. That's kind of the tip of the virus itself that latches onto our body and then causes infection in our body. We expect this to happen. All RNA viruses do this. They mutate and they change and they cause variants. And, you know, to the question that may be out there about whether the vaccine will protect us against these variants, I'll just note that the Johnson & Johnson trial in particular, that took place in South Africa and in Brazil and in the United States. And you may have heard those words, South Africa and Brazil, because those are places where variants are known to originate and be circulating. And this trial took place in those contexts as those variants were circulating. So all of those fantastic results that I mentioned before happened in the context of variants. And, you know, those of us here in Oakland and in California, there are variants that are circulating in our state and in our communities. And yet, despite that, our rates continue to drop. And so, you know, I remain optimistic that hopefully we'll just continue to move in that direction. There is data suggesting that, you know, a number of the variants may increase some degree of transmissibility, but I'm hoping with just continued proper public health protections and vaccination, we will still be able to stamp this out even in the presence of the variants. Next slide, please. I think with there, we'll pause. Oh, there was one question about children and variants. I guess I'll just say that it's not quite clear on that front. We don't quite know for sure if children are more susceptible to, say, the UK variant. The data is a bit mixed. So for now, I would just, you know, reemphasize that even in the presence of variants, all of these measures will protect against those forms of transmission. It's about masking and distancing, and being outdoors or having good ventilation and washing your hands. All of those principles still will be incredibly effective.
And at least, and correct me if I'm wrong, Dr. Sood, but at least in the reading that I've done as related to the UK variant, while it does look like kids are more capable of transmitting that than some of the original coronavirus, it looks to me like they're still only half as likely as adults to transmit it, at least based on what I've read. And if you've read something newer, please feel free to correct me.
That sounds about right to me. I don't have the data in front of me. Yeah.
One question about vaccines. You know, it seems like everybody wants one, right? Everybody's trying to get online, trying to go to CVS, trying to go to the doctor, whatever, trying to get a vaccine. At the same time, there's kind of a conflict between people wanting Pfizer or Moderna based on what they've heard. And then with Johnson & Johnson, the efficacy of it is lower with regard to actually catching the disease, but it seems like it's pretty much the same when it comes to preventing death and hospitalization. So, and I just heard something today about Detroit rejecting an order of Johnson & Johnson because they wanted to get, as whoever it was, maybe the mayor or whoever, they wanted to get the best possible vaccine. So my question to you is, what do you say to anybody with regard to what vaccine should they get, or should they just get any vaccine?
Yeah,
I would say take what you can get as soon as you can get it. I would personally feel exactly that same way. It's these numbers that you hear, the challenge with it is it's not an apples to apples comparison. Trials were done in different locations at different points in time. And so it's really hard to say whether one is better or worse just based on those numbers. And at the end of the day, the entire reason this world is shut down, the entire reason we care about this is because of death or serious disease. And all three of these were incredibly effective and powerful at combating that.
yeah, I concur completely. The best vaccine is the vaccine that's closest to your arm. And any of the three has been shown to prevent death and to prevent hospitalization.
Very good. And with regard to the side effects, you talk about the sore arm, talk about maybe feeling kind of sick or run down or whatever. Is there a difference between the vaccines, or is there a difference between men and women, older, younger? Have you seen any kinds of trends there?
The only trend I'm aware of is that folks who are younger often have more side effects than folks who are older. I think Dr. Sood's family story perhaps fits that tendency. It's really variable. I got the Pfizer vaccine. After the first day, my arm was very sore. After my second vaccine the following day, I felt pretty crummy. I had some chills, I had some nausea, and it had resolved afterwards. My parents had far fewer side effects than I did. So I think that's been seen, but I am unaware of significant differences between side effects of either vaccine.
Very good. So bottom line is, I mean,
Wanted to.
this is a situation. I'm sorry, Leilani, do you have a question?
No, go ahead, finish.
Okay. So I mean, the simple answer is whatever vaccine is available is what you should get. That's the bottom line.
Yes.
I just wanted to bring up one thing that I don't want to spread any more rumors, but I want to dispel them if they're not true. The word is going around that based on some of the studies of different racial groups responding to vaccines, that that the Moderna has been shown to be more effective with Asian patients. So can you respond to that and provide any clarity?
It's a great question. Unfortunately, I don't have the numbers on the top of my head. The last numbers I was looking at were more the Johnson & Johnson vaccine, and that was I don't believe there were any differences in terms of race or ethnicity along those lines. And I guess I would just add that was it's never as diverse as we want it to be in terms of the people participating in these trials. Each of these trials had tens of thousands of people, and different categories are represented among them. But sometimes, if it's not as diverse as we want, the signals you can pull out about truly the differences between ethnic groups and how efficacious one was versus another is really imperfect. So even if those numbers you might be seeing in the papers, it doesn't mean that it's going to bear out in real life. It's going to take some time to see that. And there's no, I wouldn't say there's any biological reason to suspect it too.
Great. We have an attendee who has a question. Ms. Galvez, I'm going to allow you to talk. So go ahead and if you can unmute yourself and ask your question, please. Ms. Galvez, if you're able to unmute yourself, then you can ask your question. All right. Well, we can come back to her. What do you, from a kind of a broad perspective, where do you think we are in this fight against the pandemic? I think there's been talk that now that within the first 100 days there will be 100 million people vaccinated.
Señorita.
Oh, sorry. Go ahead, please.
Sí, soy Evangelina Galvez y yo trabajo para personas de la tercera edad. Ya me puse la primera vacuna, pero no supe qué clase de vacuna me pusieron. Y yo padezco de la tiroides y problemas del corazón. Y quería preguntarle al doctor que si yo he escuchado que si las personas que tienen tiroides y las personas que están enfermas de una enfermedad crónica que no se pueden poner la vacuna, ¿es verdad o está bien?
I'm really glad that you raised the question. The question was about people with existing illnesses, if it's safe and if it's advisable for them to get the vaccine. And the answer is yes. The vaccine is quite safe. The only clear reason not to get a vaccine, if you are an adult who is not pregnant, is if you had an anaphylactic, meaning a serious allergic reaction to the last dose. If you are someone who has had a serious reaction to previous vaccines, it would be a good idea to check in with your medical provider. There have been some anaphylactic, meaning serious allergic reactions, but most happen within 15 minutes of getting the vaccine. And so if the person has had a reaction before, they can be monitored for that time so that they are close to help if it's needed. But whether a person might have asthma or heart problems or thyroid problems or stomach problems, it is safe for them to get the vaccine.
wanted to let our attendees know that yes, you can ask a question live, just like Ms. Galvez did, or you can put questions in the Q&A. We are running out of time, but our doctors are here and ready to answer any questions that you have. So if I may kind of finish the question I was asking, where do you see us with regard to how soon we're going to be back to more or less normal life? Masks may still be kind of at least part of our life for a while, but where do you see us with regard to all the vaccinations getting out there, the numbers going down, things like that? What do you think? What's the summer going to look like? What's next fall going to look like? What do you think?
Oh yeah, if only we had a crystal ball, right? It's been very hard to predict. I will more generally say I'm optimistic. I think the future looks far better in 2021 than it did certainly in 2020. But it's going to take some effort, and it's going to make it's going to take us all to think about all of our communities and all of our neighbors and all of our friends and family, and continue to care for them and be thoughtful for them. In ways that maybe we haven't thought as much about or need to continue to think more about.
I want to emphasize that what the future looks like very much depends on our behavior and our actions and our decisions. The date of highest hospitalizations for COVID was about 3 weeks after Christmas time, which is a time when understandably people want to be with their loved ones, where they may feel compelled to travel. And yet those are the things that put us at risk and increase spread, and ultimately can overwhelm our hospitals. And so what the future looks like depends on folks' decision to vaccinate, and also on folks' decision to continue practicing safe measures. I historically have been very pessimistic in terms of when we might return to normal, but I will state that the vaccine and already the response that we're seeing in countries where vaccination is more widespread than here really lifts my spirits and gives me hope that we may get closer to a normal much sooner than I had imagined. And yet it depends on us, and what we do now really impacts what our future will look like.
That sounds like a great place to end. Thank you very much, doctors. Thank you, Ms. Trotter. Thank you to everybody who supported tonight, including our translators. And of course, thank you to our attendees and all of our families and everybody else from the community who was here tonight. We really appreciate you. And we are very happy that we can share this information with you. And we look forward to doing more so down the road, because as you saw just tonight, there's just a lot of information that continues to come out, and a lot of progress that we're going to be continuing to see. Remember that you can get a lot of information about schools and what we're doing in schools at ousd.org/reopening2021. All kinds of different information there about our food, about what we're doing in the schools, about how we're preparing to bring students back to school, and all kinds of other things. So thank you all for joining us. We look forward to seeing you again very, very soon. So you all have a great night.